Hello, good afternoon, good morning, good evening from wherever you are. And thank you everyone for joining us today for this exciting session focused on leveraging partnership for a brighter future. We have a global audience today, and while the COVID pandemic has prevented us from being together in person, it is remarkable that we can still stay connected and engaged in this important dialogue through this digital means. My name is Bernhard Schwadlin. I work for the World Health Organization. I have the great pleasure to lead this very esteemed, exceptional panelists through a session which I think will be very exciting, and I look forward to engaging with all of you. None of the panelists need any introduction, as they have been outstanding leaders for many years and decades, and going through their biographies could take this entire session. So let me just say a brief word on each one of them and to introduce them to capture the global leaders they are. Madame Bachelet, you're one of my heroes. You have been the first female president of Chile, and you're a renowned champion for human rights, as you demonstrated in your tenure as Human Rights High Commissioner for Human Rights now. Thank you, Michelle, for participating and taking the time out of your busy schedule.
Thank you.
Natalia Kanem, the Executive Director of the United Nations Population Fund, with more than 30 years of strategic leadership and experience in the field of preventive medicine, public and reproductive health, social justice, and philanthropy, Natalia is a long-standing activist and champion for women and girls. Thank you, Natalia. Dr. Rafael Mariano Grossi, you are the Director General of the International Atomic Energy, and you're an accomplished diplomat and have been dealing with some of the most complex issues in some of the most complex areas of the world. You bring a tremendous international, you're a tremendous international gender champion, particularly in the nuclear field. And thank you, Raphael, for joining us today. Seth Berkley. My friend Seth is the CEO of Gavi, and the best description I could find from him comes from the Wired magazine, which salutes him as a dreamer, inventor, maverick, and leader. Thanks, Seth, for dreaming and inventing with us today. Inga Rushing, she's the CEO of Save the Children International. Her passion and devotion to the well-being of children is reflected by her life's work, starting at 18, working with Save the Children, and the development of her stature as a leader and respected child rights activist. Thank you, Inger, for being with us here today. I'm also very pleased that Mr. Achim Steiner, the administrator of the UN Development Program, has actually reached out to us and wanted to support the thrust of our discussion today and the ideas we will be examining. Achim unfortunately won't be able to participate throughout the whole session, but in view of UNDP's leadership in the UN system and development in the context of the SDGs on the institutional partnerships, I would like to open this session by providing Achim an opportunity to provide a few remarks that can help to frame the discussion that we will have with our esteemed panel. Achim, you have the floor, and thank you for joining.
Bernhard, thank you so much, my fellow panelists. It is no disrespect whatsoever to not be able to stay with you. It's more a commitment and an expression of solidarity in joining all of you today in addressing the World Health Summit and bringing one more voice from the UN family alongside my colleagues and those who are on the panel today from the scientific and the NGO community at a moment in time that is extremely serious. And I will try and do so very quickly. I think it is not hyperbole to say that this is the most important World Health Summit ever. One that I hope solidifies a transformation how we collectively approach health and well-being for all. At UNDP and as part of the UN system, we know that health is a driver and outcome and indicator of development. COVID-19 has reinforced this at all levels. The pandemic is exposing, exploiting, exacerbating inequalities. It is highlighting the shortcomings of our development approaches and efforts to leave no one behind. We are facing the first rise in global poverty since 1998, 130 million more people facing food insecurity this year than a year ago, a 60% decline in earnings for 1.6 billion informal workers, a disturbing surge in domestic violence, global human development combining education, health, and living standards could decline this year for the first time in 30 years since the Human Development Index began. And perhaps the most sobering of all, COVID-19 is projected to cost the global economy more than the estimated annual costs to finance the SDG agenda in full, 5 to 7 trillion, and 500 times as much as pandemic prevention measures. Amidst this crisis, COVID-19 has also awoken in us a profound reflection on priorities, a deeper commitment to a transformed world in line with the SDGs and the UN Decade of Action, and more of an openness to the innovation and partnerships required to tackle complex and multidimensional problems at scale. It is a complicated world we live in. The UN Comprehensive Response to COVID-19 and new collaborative mechanisms such as the Access to COVID-19 Tools, ACT-Accelerator, have reinforced the role of multilateralism and global solidarity. And who am I telling this to, Bernard? Nearly 90% of the 1 million voices surveyed through the recent UN Global Consultation have affirmed international cooperation as vital to today's global complex challenges. 3/4 of them view the UN an essential part of this. The SDG 3 Global Action Plan for Healthy Lives and Well-being brings together 12 leading multilateral organizations around a powerful premise: stronger collaboration yields better health. This plan can make an important contribution to strengthening multilateral support to countries for their COVID-19 responses and commitments to achieving the health-related SDGs. Together, we must harness the urgency and partnerships forged by COVID-19 into a renewed global compact in action for the SDGs. They are our compass. We must improve access to basic services across the board, including healthcare, safe water, and sanitation and education. They are mutually reinforcing. We must also, and this is where UNDP is playing a core role and contribution, provide temporary basic incomes to stem the multidimensional impacts of this pandemic and to protect the world's poorest by containing the virus. Ensure that efforts to advance universal health coverage include action on the social, economic, commercial, and environmental determinants of health. Rapidly address the digital disparities which profoundly shape people's experiences, health and well-being broadly, and ensure a healthy and green recovery, for example, by phasing out fossil fuel subsidies, accelerating the energy transition, battling pollution. Many rightly point out that 1/3 of the 2030 agenda has passed. I would say that 2/3 of the time is still left. Collectively, we have the means to change ending of this story, but only if we are visionary, courageous, not reactionary, but if we reject the return to the status quo and transform yesterday's bold approaches that we dreamt about into tomorrow's business not as usual. In doing so, we must deliver on sustaining solidarity through universality, delivering a more equitable and inclusive global social contract, and building forward better. That is our commitment as UNDP. That is our commitment as the UN family, embedded in a larger community of actors that I'm so proud to join here this morning, or rather your afternoon. Thank you.
Thank you so much, Achim, for your inspiring kickoff to our session today, and thank you, especially for joining us despite your board meeting that you have stepped out to just come here to have a short introduction to our discussions. I know that you have to leave and let you go, even though we'd have loved that if you could have stayed, but we of course understand the many demands on you. So thank you very much, and all the best to your board meeting. So with that, we will start with our panel. As Achim highlighted, much of the focus these days is clearly and legitimately on the current global health crisis the international community is tackling. And we have witnessed once again through this crisis what has come to be a familiar sentiment. No one organization, no one actor, and no one sector can tackle global health challenges alone. To that end, partnership must be translated into more strategic, intentional, measurable collaboration to truly drive change. It is through partnership that the international community has made massive gains in global health, including driving down maternal and child mortality, ensuring that more women and their children are surviving today than ever before, and achieving the global health success story of immunization worldwide. Yet, despite the tried, tested, and true collective approaches to collective problems, we have seen through this pandemic a tendency to revert back to nationalist and protectionist type behaviors, whether it be driven up the cost of essential health commodities due to duplicative demand, or inequitable access to such commodities where areas of transmission are left without stockpiles and areas for preemptive use. We also see trillions of dollars in national stimulus, while global approaches to solutions continue to suffer from shortfalls in fundings, which are only a small fraction of what the stimulus packages actually include. Thus, I would like to start by asking our eminent panelists to reflect on what we see in the world today as it pertains to partnership and collectivism. My first question: the Secretary General of the UN has stated that now we need collective action and solidarity more than ever, and a clear commitment to global common goods. What have been the key contributions of your organizations to the agenda of the United Nations, the SDGs, and to health in particular? What are the key achievements? President Michelle Bachelet, I would like to start with you. You have the floor.
Thank you, Mr. Chair. Well, we believe in partnership and we believe in collective action, and I feel that the world since certain time has started to move away from collectiveness, away from this, well, of course, multilateralism has been under attack. And we have a very particular situation as an Office of Human Rights, because on the one hand, we need to be independent, because we need to be able to be monitoring and reporting violation of human rights that can be done by a member state, but also all kinds of abuses that you can find in business or in any other kind of entity. But on the other hand, we understand that we all need to work together to move forward the common goals. So we always have to move in those two areas. And what have we been doing? Well, first of all, we have been trying to mainstream the concept that a human rights-based policy is profoundly useful to policymakers in the pandemic context, because national and global experience of epidemics from HIV to Zika and Ebola demonstrated that measures to support and promote human rights make for much more effective policies for public health. Failing to uphold human rights and accepting discriminations and inequality of every kind harms the individuals concerned and also everyone else. I mean, I agree with everything what Hakim already mentioned, and I've said that we have, we also have this normal and I would say common narrative which are the problems that the COVID-19 has shown, exposed, and aggravated. We believe that it should be more than obvious when we're talking about failure to ensure access to healthcare, shelter, sanitation, and social protection, because one of the things that the COVID pandemics have shown is the lack of investment in public health for many years, lack of investment in inadequate water, sanitation, and so on. But it's also true, not only the social and economic rights that are important, it's also important for political and civil rights, because people's right to speak, to criticize, to participate in decisions, to have information, transparent information is key to ensure that health policies can be really followed and can have the impact that we want. So measures that uphold civil, political, economic, social, and cultural rights are an important investment in people's well-being, in the country's development, and also, of course, in peace and security. What have we been doing? We have been working with countries to encourage and assist the work. Based on the fact-finding, we have tried to help shift factors that are causing wrongful sufferings to people with practical assistance. We have developed a lot of guidelines on human rights and women and COVID and women and girls, COVID and human rights, COVID and people living with disability, COVID and people with old and older people, COVID and IDPs, COVID and LGBTI, COVID and refugees, trying to come with very concrete recommendations for member states that they can follow, deal with the issue of COVID-19, because as we all know, many of us are doctors, that the virus doesn't discriminate, but it impacts disproportionately certain vulnerable groups. So that's the other, I think, important contribution that we have been doing, and I'm sure Natalia will talk about this as well, is that the virus discriminates disproportionate certain groups that are the older, women, girls, people living with disabilities, minority groups, indigenous groups, LGBTI, IDP, refugee and migrants, and I think I'm not forgetting prisoners, of course, because of the risky conditions, etc. But what we have not been seeing that countries have been doing is the intersection between both of things. What if you have a woman who's old, who lives with disability, who is poor? It will be completely different what will happen to a woman who is a professional, who lives in a good house, has clean water, etc., etc. So one of the things that we have been trying to work in the country level, we have developed with the rest of the agencies 10 human rights indicators that can be used in the response of the crisis, but also at the recovery of the crisis. Because otherwise, if we don't intersect all of this, you know what will happen? We will maintain people left behind. So those are the kind of things with concrete guidance on how to do what they have to do in compliance with the international human rights law, but on the other hand, with really concrete things, for example, how to deal with violence against women that increased during the lockdowns, etc., etc. We have tried to make advocacy on one hand, but to be also given very concrete recommendations to countries to support them.
Thank you so much, Michelle Bachelet. What a wonderful kickoff into our panel discussion. I think the way you described, health obviously is a human right, but without civil rights, you also cannot have health. And the intersection between the different sectors, even within our own field, even within health, if we don't cut through that, we will leave people behind by definition. I think that's a theme that we may want to come back to. Thank you very much for that. Natalia, over to you, your vision.
Well, thank you so much. Delighted to be here for the 10th World Health Summit. It's such a crucial time. And also, I think, underscoring the importance of multilateral approaches to solve not only the pandemic, but so many other problems that underlie divisions around health. I just want to say how proud I am as a doctor also and an epidemiologist to serve alongside the WHO, the World Health Organization, in this time, and to thank your staff for everything that you've been doing. Now, Unfpa is the population fund, and we serve as the Sexual and Reproductive Health Agency of the United Nations, to the surprise of some, but really not a surprise when you think about population as being people and the full importance of women and girls in terms of not just inequality, but being part of the solutions that we look to when we think about health in the intimacy of the family, when we think about who it is that is on those front lines. It's 70% of the health workforce that tends to be female. And I hasten to add that that is not the case for the health leadership. So the preparation of an adolescent girl, her good health is what preoccupies Unfpa. We firmly believe that the rights of women and girls are not negotiable. So I'm really happy to follow Michelle Bachelet in this discussion. Now, our program is very simple across the 150 plus locations where we work around the world. If you are a woman in labor in a refugee camp, Unfpa is there for you for the antenatal period, during the period, and up to postpartum. In a camp like a Zatari camp in Jordan, we have been able to work with mainly Syrian women under refugee circumstances, and not one of them, and it's over 12,000 moms now, has lost her life, even in these very dire circumstances. But even in a normal development circumstance, the policy issues that lead to better health for mothers who want to plan their families leads us to invest in contraception. And Unfpa is one of the biggest providers of family planning of the woman's choice all around the developing world. We've had success, yes, because in the past 30 years, the unmet need for family planning, for example, has come down from about 11.3% in 1990 to about 9% in 2019. But that still means millions, hundreds of millions of women who wish to make their own choices about when, where, whether, with whom to start a family, to have a baby. In a time of COVID, the logistics that have to do with crossing that border, making sure that the supplies don't expire while they're waiting in a warehouse, and involving our extremely adept and wonderful midwives that we support, the nurses that we support, the social workers that we support, to make sure that the transit through is promoted positively, comes up against the issue of political will, policy, confusion about the meaning of sexuality in human life and human development over and over again. Our program has been condensed into 3 zeros. 0, unmet need for family planning, speaks not only to the mechanics of delivering family planning. We're talking about women's rights to determine their reproductive futures. The second 0 is to prevent maternal deaths. And I always add that when we think about the woman who dies in childbirth, very often she's a girl. She's a girl under the age of 18 who was hastily married, who did not have a choice in whether or not to get pregnant. And we have to remember that adolescent girls are extremely vulnerable under COVID with the lockdowns, leading to the third 0, which is 0 gender-based violence. This has been a dramatic, horrible circumstance with a woman who may be trapped with an abuser during the time of COVID. How do we provide for her? The last thing I'll say is that those 3 zeros on contraception, on maternal mortality and preventing that, and to ensure that women are respected and not abused by sexual and gender-based violence all depend on data. We need to know who we're talking about. So we've been very adept through our work on census to help countries gather better data. And now, of course, there's a whole digital world opening up, and I think we can talk more about that. Thank you, Bernard.
Thank you, Natalia, for your wonderful intervention. I think the way you bring your 3 zeros away from the mechanics to people, to women and girls is so important. And also the work that you're doing in sexual reproductive health, which is an area not only of incredible health importance, but also the stigma that it may come with it and may bring with it is so important for the well-being of societies and of course of women and girls specifically. That brings me to Dr. Crossi. You also work in a very difficult area, in nuclear atomic energy. How does your work relate to health and possibly also the work of the World Health Organization? Over to you, Dr. Crossi.
Great pleasure to be with you, Bernhard, and of course with a great panel. I'm learning a lot by listening to all of you. I would say, yeah, like you say, many could be surprised to see the Director General of the Nuclear Watchdog, as we are known, those inspecting installations in faraway places or political hotspots. What do we have to do with this? In fact, a lot. The IAEA, of course, has been working for many decades on aspects dealing with the applications of nuclear technologies and science for the benefit of mankind. I'd say, and I'm very happy to be chaired by you today because we have brethren, I would say, with the WHO. For many years, we have been working in particular in the area of cancer, naturally. We have all, unfortunately, in one way or another, in our families, in our life, touched by this illness. And we all know or have experienced what nuclear medicine is, or access to radiotherapy is. In this, IAEA and WHO have been working together for decades, trying to enlarge the access of many countries to nuclear medicine. It is a scandal, Bernhard, that as we speak, half of the African continent does not have access to one radiotherapy unit. It is a scandal that 300,000 women die every year from cervical cancer, something that for those living in Geneva like you or Vienna like me is no longer a deadly illness. It is easily curable, detectable, and treatable. But this, in low and middle income countries as well, is often synonymous to a death sentence. And we have the technology, we have the means, and we know what needs to be done. So from the IAEA, we are working with you, we are working with the civil society, with the UN in general, with UNAIDS in particular, because AIDS and cervical cancer go hand in hand in many countries, to try to provide for access to nuclear medicine to many more. We train oncologists, radiologists, medical physicists, and other specialists at our own nuclear applications labs in the outskirts of Vienna that you may have visited in Seibersdorf, and in hospitals and research institutions around the world. We also have a dosimetry lab in Vienna where we help more than 60 countries calibrate their radiotherapy equipment so that patients receive exactly the right dose of radiation, neither too much, not too little. And this is only cancer. I'm sure we'll be able to talk a little bit more specifically about COVID and what we also, the nuclear guys, have been trying to do when it comes to COVID. But I'm very glad that we are doing this under this magnificent title of Partnerships for the Goals, because on a moment like this, with the situation we are living, I think partners are both a moral imperative, but also a practical necessity. I think you were very right in the beginning by saying that there is no room to going solo on these things. We all have something to bring to the table. And I will try to explain what the IAEA is trying to do to help you guys in WHO and others, OIE, in the fight against the pandemic.
Thank you so much, Raphael. And I really appreciate helping us all of understand that there's much more than the nuclear watchdog. I mean, and the examples that you gave us, especially like the cervical cancer, you're so right. I mean, the many women in the countries that have disadvantaged access to radiotherapy equipment and other equipment dying completely unnecessarily is just a scandal in a world that has so much resource available, even though right now we're all challenged with this great pandemic. Let me go to Seth Berkley. Seth, you're the head of an organization which is comparatively young to some of the other organizations, including certainly my own. I had the head of an organization which actually in itself is a partnership and carries that name in the title. What is your perception? What is your lead into our topic today?
So thank you, Bernard. And I must say it's a fabulous panel. So it's great to listen to all you. And let me just start by following what Raphael said. It is a scandal that we don't have radio treatment and that women are dying of cervical cancer. It's an even greater scandal that we have a way to prevent cervical cancer and that hasn't gotten to every adolescent girl in the world. And I know Natalia and I have been talking about this, and we're very happy now that industry has made the commitment that they will meet the demand for vaccines, and that we expect in this 5-year period 84 million girls to be vaccinated. But to get back to Bernard's question, you're absolutely right. We are an alliance, and I think what's important about that and the recognition of that is by bringing together the partners, and this is the WHO and UNICEF and the World Bank and the Gates Foundation and many others, as a public-private partnership working with industry, we've been able to transform the progress, on vaccines and move towards the 2030 agenda by accelerating equitable and sustaining access to vaccines at scale and pace. And, we know that vaccines are extremely cost effective and have a big effect. It's one of the best buys in global health. And, it also intersects where the alliance is contributing to 14 of the 17 SDGs. So, a big role coming through partnership. And in these last 20 years, as you're right, we're younger, but not so young. We're, now young adults. We've vaccinated more than 822 million additional children in the world's poorest countries, preventing 14 million deaths. And what's interesting is that if you look at that, that is the most widely distributed of all health interventions. It's led to a 70% reduction in vaccine preventable diseases, which contributing to the greater than 50% reduction in under 5 mortality rates. And if you look at it from an economic point of view, for every dollar spent on the powerful tools of immunization, it's generating about $54 in broader societal benefits of people living longer and healthier lives. So, in a world that needs collective action and solidarity more than ever to tackle this pandemic and ensure we don't roll back on the hard-earned progress of the SDGs. And by the way Bill Gates describes it, it's not exactly right, but is a good way to think about it. He said in 25 weeks, we've gone back 25 years in indicators. It's pretty striking. But I would say that, what's happened now in terms of solidarity is something that you, Bernard, helped get established, which is the ACT-Accelerator, bringing together groups in partnership to try to move quickly. And of course, COVAX, which is the vaccine part of that pillar. And what we're trying to do here is to maximize the chances of getting access to COVID-19 vaccines as quickly, fairly, and safely as possible so that no one is left behind. And so that the way out from the pandemic is multilateral and not limited to the fortunate few. And that's important as we think about going towards the 23rd agenda, because the impact of the pandemic is not equally distributed. The probability of death goes up from COVID-19 with increasing poverty. And an interesting study that just recently came out that if the rich countries buy up the first 2 billion doses of COVID vaccines instead of making them available equitably, you have more than twice as many people will die from COVID-19. So this just talks about the important solidarity. And for me, this type of partnership popping up, working quickly around the clock, gives us an exit plan. And the reason I say exit plan is that right now, most of the stimulus packages are about trying to keep the economy afloat, keeping jobs, doing the things Hakeem started talking about. But at the end, unless we stop the pandemic, we will continue to have those problems. So this is about trying to end the disease. We now have 184 countries that are engaged with us. We expect that to rise to 190 to 195 countries. And obviously, in particular, it's making sure that there is access to those at the lower end of the economy. But given the fact that no one is safe unless everyone is safe, we have to do this with solidarity and international cooperation, a global problem requiring a global solution, bringing together everybody that needs to do it. So I hope that answers a little bit of our perspective on this.
Thank you so much, Seth. Pointing out, how the vaccines, actually can help prevent disease, and the massive, massive progress and contribution that the Gavi Alliance with all the partners it describes that we made. But also, the remarkable success. You only said it in a short sentence, but the fact that almost 190 countries have now joined into one mechanism to sort of do better in terms of getting a vaccine and getting tools out on COVID to countries is just absolutely remarkable. I have witnessed the very difficult and painful growing pains of this collaboration, but I can attest that this is a model that I have not seen in my many, many years in the United Nations, how everybody has come together to push for that. And you're right, while everybody is worried about the stimulus packages and the economy, we should not forget that a small fraction of those investments could actually really contribute to ending the epidemic, and we have to really, really push the agenda to that and make sure that we have equitable access to the tools, because that will open up the world and will bring health and well-being to everybody, everywhere. Let me go to Inger Aschink, the CEO of Save the Children. You're presenting an NGO, a true NGO. Sort of Seth is a little bit of an NGO, but you're a true NGO partner here. And of course, you are such an incredible, leader from very young ages, and you're still very young. But please give us your perspective as the CEO of Save the Children. Over to you, Inger.
Thank you, Mr. Chairman, and thank you, my fellow panelists, for your great interventions. I want to talk a bit about Save the Children and, of course, of the role of the civil society. And I think it's important to say that numerous civil society organizations around the world, internationally, nationally, and locally, are working to achieve the SDGs. And quite a lot of the work being done to truly implement the work is also done by civil society. So civil society is playing a critical role in achieving the Sustainable Development Goals. And Save the Children, being one of the largest international NGOs, working in 120 countries, focusing on health, education, and protection, is of course, partnership is one of our key ways of working to make sure that we can contribute to the success of the SDGs. I want to mention a couple of things that we've been doing over the last years, and we are one of, you talked about Gavi as one of the young organizations. We are a fairly old organization. We've been around for 100 years now. And over the last century, we've been helping to significantly improve the lives of children. And we are doing that through programs, emergency responses, and advocacy. And our focus is the most marginalized and vulnerable children. And I think that we all know that even if we have seen a lot of great progress in the last 30 years, we still have a huge gap between the most marginalized and the rest of the world. And the thing that we fear the most now is, of course, that gap is widening, and it's widening quite a lot. And we see the inequalities that many of my fellow panelists have been calling out in how COVID hits the world's population, and of course, what my main focus is on how it hits children. And just to mention a couple of things, I mean, even before the pandemic struck, we had over 5 million children under 5 died from preventable causes. And half of the world's population did not have access to basic health services. And even if the pandemic was born as a global health crisis, it has quickly turned into a social and economic crisis, which will put decades of hard-fought progress for children's rights at risk. Some of the things that we do as Save the Children, we are directly reaching millions of children with health and nutrition services. We are focusing on reproductive, maternal, and newborn health, as some of the rest of the panel organizations are, and we are working in close partnership with several of you. And that is how we do it. It's very much about working in partnership with local organizations, with local governments, but also with the UN agencies and other INGOs, because we do know that by working together, that is the only way that we can shift the needle and get the real change that we want to see in the world. We are engaging in quite a lot of big movements, every newborn movement, every woman, every child movement, scaling up nutrition, because we do believe that working in partnership, civil societies, governments around the world, the private sector, etc., that is how we achieve real change. I do think that what is critical for us as an organization is, of course, also to talk about how we make sure that we are elevating children's voices and how we make children themselves part of the response. And I'm not just talking about the COVID response, but the response in general to some of the challenges that they are facing. And we're working very much making sure that we help communities to be better equipped to address some of the challenges that they are facing. But I think you can't talk about the situation in the world now and the SDGs without mentioning some of the real challenges that we see for children. This is a huge health crisis, as we all know, but I want to say something about education. Currently, 750 million children are out of school, and we fear that 50 million of those will not return, and the majority of those children will be girls. We previously talked about the risk of early child marriages, and we see that increasingly happening all around the vulnerable places, where more and more young girls are forced into marriages. We see a lot of increased violence. So this is a true crisis, and quite a lot of the progress that we've been achieving for the last 25 years are at huge risk if we are not getting the right responses and work much more in collaboration in the coming years. And I think one of the things that we are really trying to make sure that we do is that we work with not just international, because international cooperation is key, but also working with the governments in the countries where we are to promote national policy and budget changes to make sure that all responses to the COVID pandemic have the rights of the children at the front of the response. Because it's very easy to look at this as a pure health crisis and to forget the implications it has on particular children, because they are not the worst hit by the health perspectives of the crisis, but they will probably be worse hit by all the social and economic consequences that will follow the crisis in the coming years.
Thank you very much, Inger. Incredibly powerful intervention, and I think the way you describe, how also the civil society, the NGOs are actually at the intersection of bringing many of the things we have been discussed to the people. We could not do it. I mean, nobody could do it without engagement of communities, of civil society, and move forward. But I think also your plea to really include the voices of children. I mean, children are the future of any society of the world. And we haven't done terribly well in our own organizations, and I say this self-critically to mine, in really bringing young people and children voices into the decision-making. And what you're describing, that it is not very often the health in itself, because children are usually healthy. Most of them at least are not challenged by health itself. We have to make sure that we bring them the care they need. If they get sick, we need to make sure that we get them the vaccines to stay healthy, but it's the social impact. The children fall out of the safety nets, they fall out of school, which of course has a massive, massive impact on our societies going into the future, possibly for a generation by COVID. And we really need to be very much aware and keeping that in mind. I want to go jump a little bit forward because as to be expected, I think the interventions of all of the panelists are so profound that we are a little bit behind the schedule, but that doesn't matter. We have already addressed many of the questions that we had foreseen sort of in my second round, and I would like to combine it with the third question. And I would also like to encourage all of the panelists to feel free to react to each other. I mean, so much was said about the system, and I would like us to collectively challenge ourselves in the UN and outside the UN and how we can actually do better. How can we learn from this massive challenge that we see with COVID that really actually crystallizes many of the challenges that we have been talking about that makes them worse. But how can we take this as a challenge in a positive sense? How can we change? How can we hold each other accountable? And please refer to each other as we go through our next round. Let me start again with Michelle Bachelet. What is your view on that?
Well, I think we can always do better. But I have to say, Bernard, that I think as a UN, we have done it much better this time. We have been really well coordinated. We have been working with on the team on management of the crisis. I'm talking not only us as Human Rights Office, but all of us. We have been able to agree on a social and economic framework for recovery. We have been able to agree on indicators that can be used by by the UN country teams with the work on with governments. But on the other hand, we have been able to have multiple virtual meetings with many of the different stakeholders with which we are building partnership. I mean, I have been in so many webinars with business and human rights and discussing how business are also responsible in the way they do things, and that we cannot do business as usual. We need to include a human rights approach, and we need to think on how the responses don't leave anyone behind, and how we support them also, not only them at the headquarters, but across all the supply chain. For just to give one example, we have been also discussing with other colleagues and other groups or NGOs about older people or about environmental challenges, because we know that this is zoonosis. So unless we really understand the importance of intersecting on one hand climate change, but on the other hand also biodiversity and the respect for nature, we are going to be condemned to have other kinds of pandemics in the future. We have seen that with Ebola, with SARS, MERS, and now with COVID, isn't it? So we can always do better inside the UN and with other partners elsewhere. We have been done much better in terms of making our voices heard. And when I say making our voices heard, from the Secretary General, or also, for example, with Save the Children, we have been in activities calling for the children's rights, because one of my concerns, hearing what Seth was saying, and I'm really happy because when I was the chair of the PMMCH, we were in activity where we were calling for the vaccine for girls to avoid, cancer, cervical cancer. And at that time, there was not enough production. So good to know that now it is moving forward. But on the other hand, you see that because of the COVID-19 in many countries, they have diverted resources that were for vaccination, normal programs of vaccination for children. And that can be devastating the effect. Second, we have seen diverted resources from some, for example, from the treatment of HIV, malaria, tuberculosis, that they also can have a lot of lethality close to it. So there's a lot of challenges that we are trying as an office to bring in the discussions with member states, to bring in discussion with other agencies, with other partners, to see how, on one hand, we can ensure the support, the strong support, to be able to progress on the Agenda 2030, but also to deal with all these gaps that we have seen. Natalia mentioned, many countries consider the shelters and for victims of violence not as an essential services, so they close it. So we have been pushing very strongly to make our voices heard. We have written common declaration with OIM, with the refugees, talking about the rights of the migrant workers, or the rights of people, the seafarers. So we are trying to build partnership to put our voices to be heard by member states and to really be able to respond in a better way. I think that multilateralism can be improved, because I think that one of the main issues that we might need to think in the future is something that we have been already doing. Gavi is a good example, for example, is that we have been understanding that international community and multilateralism is not mainly intergovernmental. In the past, it was considered member states who get together, make resolutions, make decisions, and that's fine, and just play a fantastic role. Because if we see how much we advanced 75 years ago when the UN was created, or 70 years ago when the Universal Declaration of Human Rights, in terms of maternal mortality, etc., we have progress. I mean, this international community has done very good things, but now we need to shift. We need to consider international community with much more younger people, broad stakeholders, children, private sector, academia, etc., because we need a really, really strong push. And finally, I would say here in this part, the UN needs to show clearly, and I think on the COVID-19 response, it has done it, our added value, our relevance in this. Because otherwise people will say, well, what would you need a UN for? And I think we need UN because we also are dealing with global challenges, because the UN is not us, the bureaucrats. The UN is also the member states. So it's how we engage them to commit to do what they have to do. So we need to strengthen cohesion within countries and increase cooperation among them. And so we can recover the best possible way. And finally, what we have been saying everywhere, but I know it's easy to say, it's not that easy to do, is that our goal should not go back to normal, to the day zero before the pandemic, because the pandemic showed the inequalities. And those inequalities it permitted that, unfortunately, no one was prepared. So many people die. So many people don't have access to the basics, washing the hands, they don't have clean water, and so on. So I think we also need in this multi-stakeholders to rethink better which is the world that we want for the future, and how we build it in a way that we can have an inclusive economy, but in a sustainable way, and that we really took care about climate change, biodiversity, and so on. And of course, when we really recognize the role of women, not only by applauding the health workers, because I always say this commercial, because with Natalia, we have a very strong alliance, and with UN Women. I mean, the 12 countries that at the beginning of the first wave, we'll have to see what happens in the second wave. The second countries that did it best, 7 were led by women. So I think women show that they can also be have decisive action, very, very transparent, very honest, and people trust them. So we need both men and women, but what I want to say is I hope in the future women's rights are really considered. And of course, as always, as a pediatrician, children's rights as well. Thank you.
Thank you so much, Ms. Bachelet. Wonderful. I'm really impressed also with how well women leaders have been doing compared to some of the men leaders. So I think it is something we have to think about. I would like to mix up the panel a little bit. And while I summarize, I thought that I could ask Inger to then come after that, because not only, I mean, Ms. Bachelet, you described that we actually have done better as the UN. So we think we have done better. And I think in many ways I would subscribe to that. And the way we have found joint voices with our respective boards, something that we have been talking about before, but I think we have done better than that. But I want to test this with Inger, from the NGO side. What is your perception? Do you think we really have done better? And what is your proposal that we can continue to do better and also really build back better in the future so we don't fall back? Over to you, Inger.
Yeah, thank you for that. No, I do agree that I think that the UN has done better this time, but I still do think there's quite a lot of challenges. And I do think that, I mean, what we need to make sure, the UN particularly, but also the rest of us responding to this pandemic, is that we have a global response that delivers for the most marginalized and deprived children. And I think that, as several has been saying before me, that this is the wake-up call for the importance of global coordination. And we need to make sure that we have more focus on global solidarity and multilateral cooperation than ever before, which of course is challenging in times like the times we live in now, when we see a lot of governments turning the other way, a lot of populism and nationalism around the world. So it is it's not just the pandemic, but it's also the political landscape. So I think that in order for the UN to continue with what started as a better coordinated response, what is needed is to continue to work like that, but making sure that it's well resourced, comprehensive, and coordinated, and of course working with the rest of the actors, working with the civil society, working with the private sector, etc. What of course is critical as well is that the member states are committed to support and finance the organizations and the responses, which I think is what we see to be a challenge to some extent. And what I also think is critical is that we have seen quite a lot of challenges in many years now, where we see a shrinking space for civil society and quite a lot of threats to civil society around the world. And as I said earlier, I think that civil society is playing a critical role in the SDGs and the delivering of those, but even more so in times of COVID in our response. So the UN has to be strong in its work to uphold human rights, children's rights, etc., and really support the civil society so that we can do our part of the work. I truly agree with the approach and that we need to not build back to what we did before, but we need to create something that is better and greener and building on the whole localization agenda. And I think what is needed, and that I also include my sector, the civil society sector, is that everything that we do in building back better has to build on what the communities we serve see as their needs. And just to give you one very brief example, one of the things that we've been doing is Save the Children in our response to COVID is that we've done the biggest survey ever with children. So we talked to over almost 30,000 children in almost 50 countries, asking how they experience the COVID and the responses. And that has helped us adapt how we respond and what we do. And I think that will also be critical. Yes, we need to get the vaccines out there. We need to get the health systems to function and work throughout the world. But we also need to make sure that we address the rest of the needs that children and other groups in society will need in the future.
You're on mute, Bernard.
Apologies. Thank you very much, Inger, for your and Seth for reminding me to unmute. I think you made a number of very important points. I just want to highlight one. I mean, first of all, of course, we appreciate your encouragement that you also see that we are doing better. And I think that is an encouragement taking it forward. You were very clear. Let's be very aware as we build back, as Ms. Bachelet said. But you also said there is a danger of shrinking space for civil society, which of course is very, very worrisome. And we have seen this very often in situations of crisis, that's where we drop out. And the role of the UN in upholding the civil rights is of course incredibly important, and we should all be held account to that. Natalia, I want to come to you. Obviously, you got a lot of leads from Michelle Bachelet, but I would also pick on specifically on one thing. Ms. Bachelet said the UN is the member states. And I think we very often forget that. This is not about organizations. We are organizations that are carried, that are owned by the member states. And also, therefore, the UN can only be as strong as the member states make it, or give it the resources to act, give it the space to move. Now, you are working in very difficult areas, in some of the most sensitive areas. Do you have the support that you need? What is it that you would need to actually do even more with your organization?
Well, thanks, Bernard. And building on the other comments, thanks, Michelle, thanks, Inger. I believe that the United Nations approached our 75th anniversary this year in the right way by asking people to comment on what is their view of multilateralism and the value of a United Nations. And it was gratifying to see that over 1 million people from all walks of life, a lot of them young people, took the time to do the short survey, and it showed a lot of optimism. For example, I think it was almost 90% who said that international cooperation is vital to deal with today's challenges. And similarly, 6 in 10 saying that the UN has indeed made the world a better place, and 3 in 4 seeing the United Nations as an essential player in tackling global challenges. Because at the end of the day, the truth is the United Nations is not static. And a year like 2020 tells you that part of the unique service that the United Nations provides is exactly the partnership that our panel is bringing to the fore. And other panelists have made it very clear that the demographics of the world are of import. So I would say that for a UNFPA, which works on sexual and reproductive health and is battered by the political winds and the vagaries of sometimes within countries, but also certain types of movements, the movement like Me Too, which said stand up for women and girls, has been very positive. And of course, there are also concerns always about women as the owners of their bodies, of girls, rather than being nurtured and protected with correct information, being supposedly shielded in ignorance. And this is precisely why the adolescent girl is the one in the cohort that's getting HIV at a more rapid rate than anyone else. So I think the funding is an issue. I think member state perspectives is an issue. But for me, making very clear why it is that an older person must be respected and protected in a time of COVID. This is essential. The demographic that's young has been very, very active and vocal on things like climate change. You know, earlier Rafael was talking about the atomic energy issues, and our Secretary General has come out strongly for ceasefire during the time of a pandemic in terms of the traditional end to war. This is really crucial for people to be able to function, to be able to cross the street and do what it is that they need to do. More than that, Antonio Guterres has also spoken of peace in the home, ceasefire in the home. Now, when the pandemic hit, Unfpa got busy, and sadly, our predictions appear to be coming true. And we predicted that for every 6 months of so-called lockdown and restricted mobility and women not being able to go where they need to go to get help, girls who are no longer at school where they're visible outside the family, that we might have as many as 30 million additional cases of gender-based violence. And this is a very prevalent crime already, 1 in 3 women during the course of her lifetime. So we've also seen that lack of access to contraception is leading to greater numbers of unintended pregnancy. And Inger has already said the worries we have that girls will not come back to school. So I will say that the leadership of the UN and all of us, as we represent that SDG 10 on inequalities, is really, really important. Along with other Afrodescendiente and African USGs, we have spoken out against racism at a time when this is something that is very important to say, has antecedents and consequences in the health field. If you're disabled, and Michelle alluded to this already, why should you be made doubly vulnerable in a time of a pandemic? If you can't hear and you can't see, we have to cater for you. So I think it was Octavio Paz who said, we must learn to look reality in the face, and if necessary, we must invent new words and new ideas. This is what I expect of myself as a UN leader, and working very closely in concert with the civil society, as UNFPA really pioneered 26 years ago. So absolutely, I think the United Nations needs to be self-critical. We need to keep improving, and collaboration and partnership is what's going to make what our vision, our dream of a world that's safe for a woman and girl to thrive. That's what's going to make it come true.
Thank you so much, Natalia. Very, very important. And I like your quote of, you know, we need peace in the communities, we need peace in countries, but we also need peace at home. And we forget that. I mean, there's a lot of things and right preachers and rights, especially of women, girls, and boys who don't have the means to, you know, enforce their own rights the same way. And we have to stand up for those. I mean, that's the UN that we need, that we want, and we should always be reminded and remind ourselves and to be brave. I would like to turn to Seth, shifting a little bit between the UN and a little less UN. Please, Seth, I mean, you are known as an outspoken person. You have moved the world in many ways. What is your perspective?
So thank you, and great comments from the rest of the panel. I want to jump on what some of the things that Inger said. And, you know, she was talking about not only the role of civil society, but also the switches that have occurred as we've moved more to nationalism and populism. And to me, that's why it was so interesting to see the COVAX facility get this type of global buy-in, because I think this takes us back to the fundamentals, you know, which is, it is one world, it is connected, you can't take it backwards. The horse has already left the barn, and I think that's really important. But you asked us, how can we change? How can we hold each other accountable? And for me, it really comes back in the health sector to creating resilient and sustainable health systems. And the reason I want to focus on that is if you look at immunization, and I mentioned before that, which is the most widely distributed intervention, about 91% of children in the world get at least one dose of routine vaccine. Of course, that means that 9 to 10% don't. If you look at those families, if they don't get vaccines, they're left out of everything. And what that means is that 2/3 of those families are living below the poverty line. Their maternal mortality statistics are worse. Their, statistics from dying from other diseases, malaria, other things, malnutrition are all worse. So what we need to do is put this equity at the front of the agenda. And it's a really interesting conversation because if you look at something like bed nets, if 50% of the world has, who needs them have access to bed nets, you want to add 10%. Do you add it to the proximal to the 50%, or do you go after those that are most left behind? And I think that's the focus that we need to have. The other thing that I think is important is, as we've looked at the SDG 3 action plan, which you've spent a lot of your time working on as well, we created these accelerators. In fact, I think you were the one that originally, labeled these, and we created one around financing, because the interesting thing there is you need to have more health for the money. You need to have allocative efficiency on your spend. And this is like going for the people who are left out of the health system, building out those systems, et cetera. But we also need more money for health. And I'm sure Michelle knows this. And, as a former, president, I mean, often the health is I'm sure not in her presidency, she's a doctor, but often health is at the bottom of the cabinet priorities and is seen as an expenditure, not as an investment. And what's interesting about this is that this SDG 3 action, plan brought together UN and not UN, and Bretton Woods institutions plus traditional UN institutions. And so this work on the financing accelerator was, with the World Bank, with the Global Fund, with Gavi, obviously with all the other partners, but working together, we've been able to use that partnership to help on some of the organization around funding for COVID as well, but really about working with countries to improve their allocative efficiency and their willingness to pay. Now, of course, given the outbreak now, the number of zero-dose families has gone up. And so we've got to, go ahead and restore to those that have now been, gone backwards and now are left out. But the hope is that you can bring those back quickly, but then getting to those that are really left behind, and it's doable. By 2030, that is doable. And we may not solve all the problems, meet all the SDGs, but we certainly could create this type of universality. And to me, that's something that we need to do. So build back better. Last thing I'd say is that it is evolutionarily certain, as a number of participants have said, that we're going to have more outbreaks. So the challenge now is, how do we get people to understand that this is a true global problem? It's not a national problem. Yes, every nation needs to prepare, but the globe needs to prepare. And that means in peacetime, if I use that word, that we have to continue to invest in building these systems so that when the next outbreak occurs, we not only can the panel here say, yes, the UN has done better, but the world has done better because we've prepared and are ready to go for the next problem, and because we're going to have them. Over.
Thank you very much, Seth. Very inspiring. And you're right. I mean, even the example that you give, if there's a family that doesn't get a vaccine, they drop out of everything. It shows that vaccine is just an indicator, but it's the same families, the same people, the same women, the same girls who actually are disadvantaged throughout, and we need to find them. And it is another example of how important it is that we actually work across, we look across, we share the data. And that's what I think Michelle Bachelet said early on, that unless we break those silos and look together, we will not be able to accelerate and really achieve the goal of breaking down the inequality that is, of course, enshrined in the SDGs. But I want to hand over to Rafael Cossi. From your perspective, I mean, you have already given a number of very good examples how we do work together, but please give us your perspective of how the UN can do better with very concrete examples. Over to you.
I'll certainly try, and I have my view on this, Bernhard. I think it's clear that this, and I think we all agree from our different perspectives and angles on this concept that the moral imperative and practical necessity for partnerships is there. The issue is how you build these partnerships. The principle is there, and we all say and we eulogize partnership, but the test of the pudding is when you really have to build these partnerships. And I think what we are going through will be one of the ways in which we will be judged, and rightly so, because we have a huge responsibility here. What I see is that when we come to the current crisis, there are still some, and I'm sorry if I get into something which may be a bit more controversial, but there's still some pushback. Behind all the barrage of nice words about partnerships, sometimes when you want to establish these partnerships, there's still a bit of I would say bureaucratism, a bit of territoriality in this area. For example, now the IAEA is offering a Zodiac, which is a zoonotic disease integrated action program, where we are going to be partnering with you, WHO, with OAE, as we did in the past, with FAO. We are trying also to integrate the private sector. Seth was giving excellent examples from the vaccine side. We are bringing people who have been working in this area, but we still see sometimes that there is a bit of this thing, well, who is doing what, etc. I think we have excellent concepts already shaped and established, like the One Health, for example, which you haven't mentioned yet. And I think we owe a lot to WHO on this regard. But I think that we still have to overcome a number of cultural and bureaucratic barriers that are preventing us from getting to the top of our abilities and the top of our possibilities. I think here is not so much about taking credit, but bringing all the possible forces to the table and offering products, if I can use this economic word or commercial word, vehicles that are going to do the job, because this is what we need. We need the vaccines, and we heard about that. We need the prevention. We need the zoonotic aspects that come on top of it. Yes, it's true, we've done better, but I still sense, and I'm sorry if I draw a little bit of an attention, but I think it's also important in a panel, in a top panel like this, to say that we are still seeing some resistance to this cohesion that we all need. I think it's also something where we have to work hand in hand with member states, as Michelle was saying. We are all part in this, and we should make every possible effort to avoid politicization and to, from the secretariats, to show that we are indeed working together, that there are no differences in the approach, because the enemy is out there, and is the pandemic or is cervical cancer. It's not if it's WHO or the IAEA. We're all transient in something which is much bigger than us, and is embodied in this formidable ideal of the UN, if you want. So my impression is that we have to do better in the forging and the shaping of these partnerships. We have to be more adaptive to partnerships that are going to be completely different. For us in international organizations, as you know very well, or only collecting the assessed contributions is going to be even more difficult every year. So we need to open up our minds and think how to work with the private sector, with civil society, with non-traditional donors, with regional development banks to provide the service which is expected from us. From the IAEA, we are ready to do it, and we hope to be doing it together with you.
Thank you very much. Michelle Bachelet, I see that you are wrapping up. You have to leave.
Yeah,
But you know,
sorry.
if you can give us
I have to
one
go
word.
with your boss. I have a meeting with your boss.
What is your meeting, my boss? As you stand up, with one word, what is your vision for 2025? Then you can go.
Oh, well, a world where we are already starting building much better. Of course, without pandemics, but mainly with a world who could really deal with the huge inequalities that we see worldwide. Because I think that it would have been able to accelerate more on the Agenda 2030. We have been better prepared to respond to the COVID-19. And so I wish a world where we're building all back better, where everyone has more opportunities and their human rights are respected. Thank you so much. All the best
Thank
to
you
all
very
my
much.
colleague panelists. Bye-bye.
All the best. Thank you. Thank you, Ms. Bachelet. All right. So with that, we come to the last round. I mean, the time has been passing faster than we had planned, always, of course. And I already started with Madame Bachelet to sort of ask her for a big vision to 2025. I would like to give the same question to all of the panelists. And you can take a little bit more time. We still have time to go through a full round. So think about it. And if I can start with Natalia, I see you smiling already. You seem to be ready to jump in and give us your big vision. Over to you.
Thank you. Thank you. You know, it's important to have a vision so you know where you're going. And for Unfpa, we actually believe that 2030 is our correct target. Everything we do is built on the Sustainable Development Goals. And of course, that's the world consensus. And by that time, we want to see an end to female genital mutilation. This is something the world can achieve. Every day, over 30,000 girls under the age of 18 get married, and for many of them against their will. This is something that's going to change by 2030. Collectively, and I love what Rafael put on the table, we do have to overcome barriers that prevent us from working in synergies together. For Unfpa, whether it's academia, young people who were so vibrant at the Nairobi summit, private sector, you name it, we're looking for partnership because part of the vision that we have for the year 2030 is that young people's ideas are respected and that they find their way to a table where they're not a guest, they're part of building that greener, bluer society that we're talking about after COVID. And speaking very sincerely from New York, where we saw the devastation of a pandemic that was no respecter of persons. As a public health professional myself over decades, I am looking forward to a world where we will be led by data and by evidence, where we're not going to shy away from the hard truths, where debates will be open and everyone will be invited to put their perspective on the table, but the procedure for what we do in order to resolve some of these pressing human problems will be based on the scientific methodology that works. So it's really important to me to keep underscoring that we gather together for a purpose. These partnerships are for a reason, and that is to make the world better for a 10-year-old girl in some village somewhere. She's on an island nation somewhere. She has to be assured that she's going to have the same fair shot at life that she deserves fully, and that everyone deserves, I dare say. I think there are a lot of thorny issues ahead, and some of them do hinge on sexuality, unsafe abortion, the rights of LGBTIQ people, the ability to be able to speak out when something is going wrong as a child who is being assaulted by gender-based violence. All of this really depends on us being able to speak truth and to seek truth through data. Thank you.
Thank you so much, Natalia. Wonderful. Very, very strong. Seth, I would like to hand over to you. What is your vision for 2025?
So like Natalia, I'm going to put it in a 2030 vision, and I'm going to give you two of them. The first is, I really think, as I implied, that we can get to universal immunization by 2030. And what I mean by that is that there are no more zero-dose children in families. And if we do that, as I said, that has spillover effects in all other aspects of health, but also directly in prevention and creating surveillance and having people included in a health system, which would be an extraordinary thing. And I think we should get there. And that's how we're going to move forward in terms, because you mentioned measurement before, how we're going to start creating ways for countries to identify, using all the new tools that exist today, and really try to be able to track down to that subnational level and be able to bring people into the health system. But the second thing is, I don't want to be in a position anymore where I'm called a coronavirus Cassandra, which I was called over and over again. We have been talking about these outbreaks for a very long time, about the need for that. And what I would like to see is the world with a strong system of surveillance for disease, financing mechanisms that are ready to go so we can move quickly, vaccine platforms that we understand that we can plug new agents into, production facilities that are able to scale up, and of course, countries that are ready to deliver them. Because as I said, it's evolutionarily certain. We're going to see more frequent outbreaks. And so this is something we can do. And the only way to do it, though, means keeping political focus on it and financial focusing on it going forward. And of course, it isn't going to be one agency, one group. It's going to be the world learning from each other and working together and sharing information to be able to do that. That is going to be critical for our survival as a species. And frankly, if anything we can do, if the silver lining from this outbreak is this type of cooperation, it's the same issue for global warming. I mean, you have the same exact problem, which is one country can't say, well, I'm going to take care of myself and it doesn't matter. Same thing in global warming. You can be perfect in your environmental issues and everything else, but if the other countries around you aren't, it has an effect. So we've got to get back into the global commons conversation, even with our differences. And, I think in a way, pandemics are a real way to focus the mind on this, because, it doesn't matter how rich and powerful you are. Look at what's happened given this little virus, which in a few months moved across the world. Over.
Thank you, Seth. Over to Rafael Grossi. Give us your vision for 2045.
Well, I'm a reasonable optimistic. I feel we can improve. I feel we will improve, but we have huge challenges ahead of us. Some I try to articulate in my last intervention, but we still need to get more better organized. And I love the example Seth just gave, because it touches on some other part of my job, which is on energy. And there on energy, you see a lot of this exclusivism and pushing for the technology you like or the approach you like. The common issue is decarbonize the economy. And there are many ways to do that. The common issue is COVID-19. And there are many avenues to do that. The common issue are the human rights. The common issues are those that Natalia and Inger described so aptly. But I think we have to use the power of diversity, accept that there are no size-fit-all approaches, and that we are condemned and doomed to work together. Otherwise, we are doomed.
Excellent. Thank you. Thank you so much, Rafael. Let me come to Inger. And I think this is not because we wanted to have you last, because you come last, because we want to give you the last word. You work for young children, basically. That's your NGO. And we have borrowed the world from young children because that's their future. Please give us your vision.
Thank you. And I do agree with a lot of what has been said by my fellow panelists, but just to add a couple of things, and I think having the 2030 ambition and vision is the right timetable. And I think that I think that it's incredibly important that we remain optimistic. We have set a goal for the SDGs on delivering on those on 2030. And I think that is the goal that we should keep. If the situation for children and other groups are worsening by is 3 times worse, then we need to make sure we have 3 times the impact, and that we are 3 times smarter and 3 times faster, etc. So I think this is the time where the world needs to come together, and particularly the positive forces that I think that we are all part of, regardless of what organization we represent. But this is the time of partnership, collaboration, having new innovations, new ways of working together. And I do think it's critical, as I've been saying a couple of times already, that we make sure that we really, truly listen to the communities that we serve, that we give a real place around the table for children, for adolescents, for women. I mean, all groups should be represented and be part of not only discussing the problem, but also identifying the solutions. Because I think, the only vision I have is a world where every child has a future, because every child deserves a future. And we need to really believe that we can make a world where violence against children are no longer tolerated, where there will be peace everywhere, including in the home, where everyone has the right to development, to participation, to protection, health, etc. So I think that it is critical that we are listening to the people we serve and remain focused and committed to the agreements and the commitments we've already done.
Thank you so much, Inger. This brings us to the end. I think we are just on time, and I don't want to say a lot because I think all the panelists have just been exceptional. It has been an exceptional, inspiring panel, and I'm really feel humbled to be part of it, and have been able to maybe support a little bit through the moderation, but it was really a great discussion. A couple of things that I sort of picked up, and I just want to leave as we leave this session. What I heard is, a quote from Bill Gates, which I wrote down: in 25 weeks, we have lost 25 years of development. Let's make sure that we don't take 25 years to recover. Let's make it 25 weeks. That's maybe a little bit ambitious, but let's work together, and we have to work together to achieve that. The other thing that sort of came to my mind, it was partly triggered by, I saw a book in the bookshelf behind Natalia from Mandela, one of my other heroes. There's a saying, of course, that all of us have used a lot, but it is bringing together many of the discussions. If you want to go fast, go alone, but if you want to go far and want to sustain, go together. I think that was sort of the theme of this discussion. And, the plea that Natalia brought to us, I want every child to have a future. It couldn't bring it better together than, than just saying that, because that is what we all are about. Every child should have a healthy future and thriving as we move forward. This brings us to the end, and great thank you for the organizers to bring us together, and a big, big, big thank you to all of the panelists. I think you have been just wonderful. I think this session has been recorded, so we can watch it again or can share it with others. I think it's definitely worth it. There's one more session coming up, the closing session, that actually builds on many of the discussions that we had in the World Health Summit. This will be a session around the SDG Global Action Plan, which has been mentioned by many of you, I think, which is really an innovative way of working towards a better collaboration to achieve results. And I think we start to see real results of that. And I think this discussion may help to further sharpen how we can do better moving forward. With that, I thank everybody and let you go. And I hope to see you soon again. All the best. Goodbye.